Now, I would like to introduce Dr. Amy Lang. Amy is the Executive Director for Patient-Oriented Research at CIHR. In her role at CIHR, she leads the strategy for patient-oriented research, as well as other patient-oriented research activities. Amy is trained as a social scientist and has a strong passion for equity, diversity, inclusion, and accessibility. Prior to joining CIHR, she founded one of Canada's most robust patient and public engagement programs at Health Quality Ontario, now known as Ontario Health. And so, Amy, welcome.
Thanks so much. It's great to be here. And it's really great to be speaking to an Ontario audience, having moved from this province very recently. I still feel like this is my home and this is my crew, so it's great to be able to speak with you all today. So Vasanthi asked me to focus my remarks today on the future of patient-oriented research in Canada, which is quite an ambitious title, being only 6 months into the job. But I'm happy to do that. And I know that with this community and this audience, you're all very familiar with SPOR. And so my goal in the talk today, if we can turn to the next slide, is to not just talk about SPOR and where we're at with the strategy for patient-oriented research, but also what is my mandate in this new role as Executive Director for Patient-Oriented Research? How does that align with our mandate at CIHR? What are some of the early opportunities that we see for patient-oriented research above and beyond the strategy for patient-oriented research? And then talk a little bit about some of the challenges that I think we're all actually going to have to collectively address in order to continue to grow patient-oriented research in Canada. And I'll try to do that in about 15 or 20 minutes so that there's lots of time for Q&A as well. So if we could go to the next slide, please. If any of you have read CIHR's founding legislation lately, you'll remember that our mandate is quite ambitious, and it is to excel according to internationally accepted standards of scientific excellence in the creation of new knowledge and in the translation of that knowledge into improved health for Canadians, more effective health services and products, and strengthened healthcare systems. Next slide, please. And I really see patient-oriented research as trying to be picking up directly on the challenges that CIHR has in addressing what is written there in the legislation about its mandate, and the challenges that we as an agency and that we as like a research community face in achieving that mandate. So patient-oriented research picks up on the challenge of excellence in the creation of new knowledge. And again, I was able to hear the tail end of Nav's presentation. It's picking up on that theme of like we are recognized internationally for producing scientifically rigorous research that is recognized for its impact, and yet we know that there continue to be equity, diversity, and inclusion gaps in terms of who participates in the creation of that knowledge. And that those gaps introduce biases that undermine research excellence and also undermine the relevance of research to Canadians. And so that's part of what patient-oriented research is here to do, is to try to redress those gaps. And I also think that patient-oriented research tries to address gaps or challenges that CIHR faces in achieving the other half of its mandate, which is translating research evidence into improved health for Canadians. I think we're all aware of the evidence around how long it takes for knowledge that's produced to make it into practice. And there are gaps along the way from laboratory to clinical study to implementation into practice into population health that we could talk about for a long time. And so if you go to the next slide, from my perspective and from what I've learned being in this role, these particular challenges that face CIHR in achieving its legislated mandate were really some of the core factors driving the establishment of the strategy for patient-oriented research. And it's deliberately titled Canada's Strategy for Patient-Oriented Research, because it's not just CIHR that's doing this. As you know, we do everything through partnership in this strategy. So the quote here on the slide illustrates, which is a quote at the launch of the strategy for patient-oriented research, is that from the very beginning, SPOR and now POR are just focused on this sort of dual track of how do we do a better job in co-producing research with patients and caregivers and clinicians and knowledge users, and how do we make sure that we can find ways to apply that co-created research evidence in health policy, healthcare, and health outcomes. And so that's kind of for me, the parameter, the big box that's put around patient-oriented research that we have to return to, because sometimes patient-oriented research is focused solely on patient and caregiver engagement. And it's that other half that I think we all are probably going to need to pay more attention to and increasing attention to in the coming years. Next slide, please. Where are we today? Well, I'm coming into this role with a lot of being able to kind of stand on the shoulders of giants, which are all of you in the patient-oriented research community. And we've got some pretty good evidence to document the impact that SPOR has made over the last 10 plus years. What you see on the slide here are some findings from the first evaluation of the strategy for patient-oriented research that was conducted in 2016 that showed that our collective investments and efforts were aligned with international trends, that we were focusing on the right things, the elements and activities to address areas of need in terms of growing our country's capacity for patient-oriented research, and that a particular strength of the program was the partnership work that has happened and continues to happen in order to share knowledge and kind of build on our collective strengths. And anecdotally, since 2016, in looking at the performance reports that folks file with CIHR and in speaking with leaders of different SPOR-funded entities, it's very clear to me that there's been a cultural shift within the research community where patient-oriented research has become, if not a routine thing that everybody does, at least an accepted thing that some people do and do very well. And that's a really, really important accomplishment. And it's something that is impacting, CIHR in terms of its direction, because now not only does the strategy for patient-oriented research create funding opportunities to support this work, but you'll see many other institutes doing that outside of SPOR as well. Many researchers, even just in like general project grant competitions, are referencing patient-oriented research elements as well. So this is the success, I think, of SPOR and all of the work that you and others across the country have done in building up a culture of patient-oriented research. And we also hear a lot at CIHR from members of the public. And it's very clear now that patients and caregivers who have been, grown as a community of advocates over the last decade and a half, I would say, are holding CIHR to account. And so there's like an expectation also on the part of patients and caregivers that we will continue as well to focus on patient-oriented research and look at ways that we can grow it. Next slide, please. So the next slide, this just shows our current state program map. So the connection between our sort of evaluation and this emerging evidence around this culture of patient-oriented research is that CIHR has clearly recognized that there's value in continuing an investment in the strategy for patient-oriented research. And all of this work has led to phase 2, which you're all very familiar with, of the support units, of the chronic disease research networks, and continued investment in some national platforms like the Evidence Alliance, the Canadian Data Platform, and the National Training Entity. And all of this is kind of up and running now, and we'll kind of continue and work through that over the next 3 to 4 years. So we're in a good place, I would say, and where we're going to be able to kind of advance patient-oriented research through SPOR because of the focus of the support units and the networks on knowledge mobilization and implementation, which is I think what are some of the questions that people still have around patient-oriented research. Next slide, please. Also important to note in terms of our current state, we've got new leadership in place. So a little bit about me. I am a social scientist and I'm coming in from the kind of healthcare administration space. So I really do see myself as a knowledge user and a knowledge mobilizer. And I've been a knowledge user on research grants many a time. And sort of to balance me out. And so that's kind of a lens that I take to this work. And I'm excited to sort of explore with the community, how do we advance things on that side? And then I also want to give a shout out to Jennifer Campbell, who is our new manager of the strategy for patient-oriented research. So she's taking over from Nancy Mason-McClellan. She has a really wonderful track record within CIHR in terms of managing different strategic funding opportunities. So she's got that great strategic lens, as well as being a really amazing manager of operations as well. And she's on the line today as well. So we are your 2 people to connect with over the coming months and years about this. Next slide, please. So looking forward, Some of you may know that now our patient-oriented research program, which is SPOR Plus, is housed within a broader strategic funding portfolio called the Learning Health Systems portfolio. And I think this is one of the questions that I was asked to touch on. How does POR connect in with learning health systems? Well, the way that CIHR has tried to conceptualize it is that we brought together a whole bunch of different portfolios and added some new ones. But the common theme that unites us all is that we're focused on knowledge mobilization and evidence integration and responsiveness to emerging issues. So you've got patient-oriented research, you've got the new Center for Research in Pandemic Preparedness and Health Emergencies. You've got our new clinical trials fund that's established. And then we're also co-housed with equity strategy and inclusion and science policy as well, which focuses on knowledge mobilization, research excellence, and training and capacity development. So as we're trying to think about where our strategic investments lie, we're working together as a leadership group to make sure that things that we've learned from patient-oriented research are overlaid into the work of the Center for Research in Pandemic Preparedness, into the Clinical Trials Fund, and into our different other different strategic funding opportunities, as well as being able to leverage the great work and knowledge of our equity, diversity, and inclusion team and our science policy team, and embed that into POR and these other initiatives as well. Next slide. And I think this really just sort of is again sort of a slide to show that we're looking actively at how do we embed patient-oriented research into funding opportunities on preparedness and health emergencies, into clinical trials funding opportunities. We're looking at the intersection between patient-oriented research and knowledge mobilization, and how does the work that the KM team, how can that inform all of us in the patient-oriented research community going forward, as well as in collaboration with some conversations on the Pan-Canadian Health Data Strategy and CIHR's role in helping to advance that. So patient-oriented research is not just one set of activities, but it's almost like a lens and a set of criteria that we're applying to a bunch of different areas. And that's true not just for the Learning Health Systems portfolio, but also for the work of the institutes across CIHR. So almost all institutes have people with lived experience on their advisory boards. Many of them are including patient-oriented research elements in their different funding opportunities, and some are co-designing funding opportunities with patients and people with lived experience and community members. And that's amazing. So it's not that I'm coming in and having to kind of help start a program from scratch. My role is really to kind of help align and work together with colleagues across the organization to work in a more coordinated and concerted fashion to move things forward. Next slide. And this is, so there's the work of the Learning Health Systems portfolio and the institutes. And then I would say patient-oriented research is also very much embedded in CIHR's strategic plan. In our vision for the future, which is to achieve the best health for all, and focusing on equity, diversity, and inclusion specifically within that definition. And then if you go to the next slide, within the strategic action areas as well, there's a patient-oriented research element to each of these. So I think there was some concern when this strategy was released that the word patient didn't appear explicitly. And I think that's because it's actually implicit in the thinking around every single priority that was articulated. And if you go to the next slide, I'll show you how that thinking is implicit there in some of the work that we're doing. So it's a bit of a busy slide. Apologies for that, but we can share them after the fact. But within each priority area, our team is actively working, for example, with the team that's working on advancing research excellence. We're working to take the lessons learned from SPOR and patient-oriented research about inclusive concepts of research excellence and what does true co-design of research look like, and embed those into the sort of more general definitions of research excellence. We're looking to take the lessons that SPOR has created around partnership and looking to embed those into more generalized practices across CIHR. Same thing for strengthening health research capacity. What have we learned from the training and capacity building that we've done that we can build in to our work going forward? We're collaborating very closely with the Institute for Indigenous Peoples' Health in terms of embedding requirements around Indigenous health into our funding opportunities in SPOR, but also thinking about how we can work together to advance through other opportunities. Same thing for pursuing health equity through research. And then the last one, priority E, is one that I'll flag because this is where SPOR is explicitly mentioned. In addition to working with our knowledge mobilization team to make sure that the lessons that we've learned through patient-oriented research are embedded into the frameworks that are being developed, We have an evaluation underway this year, and I know many of you have participated in that, so thank you. I'm really excited to see the results, to hear the results of that evaluation. And we also then, next year, based on the results of the evaluation, have committed to a process to refresh the SPOR strategy, which I think will probably be a conversation not just about SPOR, but also about patient-oriented research more broadly. So it's there in the way that CIHR is structured and in our strategic plan going forward. Next slide, please. I will say, as much as there is opportunity for patient-oriented research at CIHR, there are some really important challenges that keep me awake at night in doing this work. Again, to pick up on the fairness as excellence theme, there's a lot of work we need to do still to embed equity, diversity, and inclusion in health research and in patient-oriented research. Although I would say there's been maybe more attention and conversation around this within the patient-oriented research community than within other areas of health research. So we've made a good start, but there's more work for us to do. And I think that's going to actually force us to really gain traction in embedding EDI in patient-oriented research. We're going to have to rethink some basic concepts, things like the word patient, because it doesn't resonate with many people. And I think we're also going to have to rethink some of our engagement practices that are currently in use in patient-oriented research, because they don't work for people from all communities, and particularly communities that face barriers. Next slide, please. The second challenge that keeps me awake at night, as much as equity, diversity, and inclusion does, is the research to practice gap. And so I think from looking at the performance reporting on SPOR, it's very clear to me there are fantastic case studies and individual examples where patient-oriented research has really successfully partnered, created new knowledge, and that knowledge has been applied. But those remain isolated examples. So to use a learning health system metaphor, we need to turn those data points into knowledge. And that's our challenge right now. And that's our challenge, not just in order to continue to improve our practice, but that's a challenge in order to continue to receive attention and funding investment for patient-oriented research. Because it's a partnered program, we need to be able to show a return on investment that resonates and is relevant to folks that are outside the research community. And that's where I think we can all roll up our sleeves and do some work to think about how can we do that in an effective way in the coming years. Next slide, please. And then, of course, there are a lot of practice challenges as well that I hear about that we may want to think about. How do we improve on? So terminology, models of engagement I talked about. We've done a lot of investment in training and capacity building for researchers. Our colleagues to the south at PCORI are now also looking at how do we view, they now view patients as part of the research community as well, right? The research workforce, to use their term. And so that's something I think we could think about here in Canada as well. How do we build up the training and capacity of patients to really be true partners in the research enterprise? Lots of sort of policy questions around payments and how do we support people to be active participants? Lots of things we could improve about our administrative processes, which do create real barriers for people to be involved. And then, as I mentioned before, a lot of practice challenges around performance measurement. And I think there's work that we can do at CIHR to improve what we're asking of all of you. And I think there's work that we'll all need to do together to figure out what are the right things to be measuring that really kind of hit home the message that this is valuable work. So just to sum up, there's lots of opportunity to grow patient-oriented research. You're already starting to see it being embedded into CIHR. And we have lots of work to do together. And I'm super happy to be here today to start the conversation and to continue it over the coming months and years. Thanks very much.
Wonderful. Thank you so much, Amy. Maybe I'll start with a couple comments that came in. One from Sandra Holdsworth, that congratulations on your new position. You'll be missed at Ontario Health. However, I look forward to your leadership and patient engagement at CIHR. That was from Sandra Holdsworth. And the next one is, yes, SPOR is spread into other areas outside of healthcare research, with SPOR leading the way, and patient caregiver engagement better practices are entering into industry, innovation, education programs, and community groups. So that was a couple comments. In terms of questions, you touched upon it. Maybe if you could go into a bit further detail on how CIHR is planning on incorporating patient partner research into the other CIHR institutes, including future funding competitions.
Yeah, thanks for that question. I'll go into a little bit more detail about the work that we're doing. So since I've arrived, my first question is always, well, what have we already done? And I've worked with our team over the summer to do a scan of those activities related to patient-oriented research across the institutes. And we're also looking at pulling data from our CIHR's funding data analytics systems in order to get like the big picture. So the good news is there's a ton that's already happening. I mentioned that the institutes, almost all of them have people with lived experience on their IAB. And I would say almost all of them are including patient-oriented research elements in their funding opportunities, at least some of the time. And so I think where we're headed with this is to say, given that this is already happening, our job now is to figure out how do we become more consistent in our practice and make sure that we're doing this in like a kind of wise practice, best practice kind of way based on what we've learned in the field. And fortunately, the institutes have taken it upon themselves to kind of create their own community of practice around patient engagement and patient-oriented research. And so there's already kind of a group that's formed to help facilitate those conversations and that alignment. And so that's the work I would say of the coming year. And then we'll be happy to share once we've figured out, okay, this is how we're going to work our way towards a common, minimum set of common practices. That's something that we'll want to share back with the field.
Good. And maybe push a bit further in terms of clinical and applied research and health services research. Is there any thought to maybe mandate is too strong of a word, but in the funding competitions, sort of mandating that we have patient partners?
Yeah, I think absolutely there's thought around that. And I guess, and so the question is trying to make sure that we're doing it in the competitions that are, well, I guess there's sort of different tensions that you have to work with, right? So there's a group of people who already believe in this, and there are a group of people who still are like, kind of scratching their heads saying, I don't see the value here. And so I think there's work that we have to do still to communicate the value, maybe especially like in bench science, doesn't happen quite as much, right? It's much more kind of common or accepted practice in institutional and population health. So we have some work to do to try to communicate and show people the difference that it can make. And we're lucky actually that we have some of our institutes who have really amazing scientists in those areas who can help us, who are also very dedicated to patient-oriented research, who can help us with that. That's what I would want to do. I'd probably want to try to show the value of it before kind of making it a firm requirement for everybody to do all the time. But as we do that, then we kind of grow both the capacity of people to do it, the interest and appetite to do it, and then we can kind of layer in requirements as that capacity and that appetite grow.
Great, thank you. And we have a question from Maureen Smith. Thanks for this excellent presentation, Amy. For priority B, which was strengthening the patient-oriented research capacity, mention of patient-oriented research training and career support. Does this include training for patients and caregivers? Would be great to have a pan-Canadian approach, lots of replication occurring.
Yeah, I think to be very honest, when the strategic plan was written, I think they were focused more on health researchers rather than patients and caregiver health researchers who are health researchers, right? But people going through that kind of formalized training. And so the work for our team is to say, hey, patients and caregivers are also health researchers who need support for training and capacity building. And how do we build that in? And that's part of the investment that I think is maybe on our program map. We're still sort of working with to kind of focus on that, which is the national training entity, which has most recently been funded. And they're still sort of trying to figure out what their program and their offering will be. But I think that's something that we can work with them to try to identify what are the opportunities, not just to focus on folks going through academic training and kind of research career pathways, but also patients and caregivers.
Good. Question from Stuart Nichols. I was wondering if you could talk to the collaboration and interaction between SPOR entities, but also where there may be overlap. How can SPOR entities work together without unnecessary duplication or waste? and as an example, SPOR NTE and existing training and capacity development initiatives?
Yeah, it's such a great question. I'm not sure that I have the answer for you today. I do know that that I think it's the expectation, and it's written into the funding opportunity, that there will be collaboration. But I think historically there's been a sort of a perspective at CIHR that it's over to you as the grant recipients to try to figure out what are the best ways to interact. So that's sort of, I think, are the basic paradigm that we're working in, is that we don't want to be overly prescriptive and what are the best ways to interact, but we just hope that there will be interaction. And then if there's a role for us to play as a kind of catalyst or facilitator in that, I think that's a role that we at CIHR, our team, would be happy to play as well.
Very good. So from Frank Gavin, how can we reconcile the tension between the substantial time it takes to engage and involve patients in a substantial way and the pressure to reduce the time it takes to get research into practice?
What a great question. I'm just reading it again to think about how to answer it. The pressure to reduce the time it takes to get research into practice. I guess I don't, I think this kind of goes to a point that was made earlier in the day at the Learning Health Systems presentation. I think it was Tess Romaine who made this point, that really we have to start seeing this not as an add-on, but as a better way to do our work. And so if you look at it that way, engagement of patients and caregivers upfront, and engagement of knowledge users upfront, and people who will actually, be doing the work of getting research into practice, is actually a worthwhile investment of time. Even if it takes more time up front, that actually increases your success rate and your ability to do that knowledge mobilization at the end of the day. So I think it's maybe a bit of a mental shift in reconciling the time, and then in reconciling those conflicting pressures and perspectives on time.
Good. Question from Lucy Langford. Thank you, Amy, for a great presentation. The knowledge to practice research gap is something that keeps me up at night too. From my perspective, I think a big barrier to including people with lived experience more meaningfully and sustainably is time. In the future, I'd love to see people with lived experience involved with timeline feasibility at the funding opportunity level.
Yeah, thank you for that comment. That's something that's feedback that I've heard as well, and I think it goes back to what we can do at CIHR is recognize that it actually does take time to build up the relationships, so that when a funding opportunity arises, you have those relationships at place that allows you to bring people together to respond to it. So that's where we're looking at things like different sort of funding opportunities that would actually fund people in some of that relationship building work, and looking at how we can kind of either make that fund those explicitly, or make them a component of some of the other opportunities that we're putting out there, because we totally recognize, based on your comment and other feedback that we received, that's an issue in terms of having engagement that's actually meaningful and has an impact and makes a difference to the course of the research.
Yeah, good. And a comment from Tridi Koreshe. Based on your experiences, what strategies, activities have you found helpful for healthcare organizational change with respect to the engagement of patients, families, and caregivers?
Oh, Tridi, thank you for asking that question. That was kind of my job for my tenure at Health Quality Ontario. So at the Quality Agency, all that we did was try to figure out how to promote the engagement of patients and caregivers in actual change and implementation of evidence-based practice. So I could go on at length about that, but I would say Ontario is in a good place because historically we have a lot of legislation that says we have to have structures in place. That's not enough. You actually need people and leadership. I really like the engagement capable environments framework that says you need to have the right structures that bring patients to the table, but you also need to have leadership and you all who champions the work, and you also need to have appropriate kind of training and support for staff who are already very busy doing their jobs in order to enable them to be open to change and to collaborate with patients. So that's my kind of framework that I always return to, and it's a Made in Ontario framework. So another great contribution of the patient-oriented research community to this practice.
Good. And another comment from Sandra Holdsworth, and one that we hear often. We need to have more data on the impact of including patient partners in research. So more researchers will see the value in it. She comments that every researcher that she has worked with has commented that my input has helped them with their research, and points were made that they hadn't thought of.
Yeah, and it's interesting to me that we're still at that place in Canada. I had the chance to meet with Julian Elliott, who was in town for the GIN conference last week, the Guidelines International Network, and he's done some pretty amazing research in work in Australia around evidence synthesis, and they have a patient and caregiver, what they call a consumer panel, that's involved in that work. And I asked him a kind of a similar question to what the point that Sandra's raising, which is, well, how do you convince all these people who are working very rapidly to synthesize evidence to pause and reflect on the contributions of patients and caregivers? And it was a no-brainer for them. They said it's just accepted that patients will have different questions that need to be answered and are focused on different outcomes. And it's important to make sure that the work we're doing is focused on the questions and the outcomes that matter to patients. So it was kind of an interesting, it was very interesting to hear that they've arrived at a place in their research culture where it was very clear the difference that patient contributions can make, and that there was a buy-in to actually addressing those different questions and outcomes.
Good. And another question, and I'm sorry if I'm pronouncing the last name wrong, but Maggie Karastecki, is any work being done to align Ontario's work in this area with the other territories and provinces in Canada, so that there is an equitable and consistent approach to patients and caregiver partnered research?
So I really think that's a question for OSSU more than for CIHR, but I do know that the different SPOR funded entities meet regularly to collaborate and align with each other. And I don't know, Dean or Vasanthi, if you'd like to respond to that further.
Yeah, so maybe before Vasanthi chimes in there, that there is the the Ontario, the SPOR Support Unit Council, the SSU as it was referred to earlier, that meets on a regular basis and tries to align both initiatives and their work. Vasanthi, do you want to add to that?
I think you've said it very well, Eddie.
There we go. Very good. Any last minute questions for Amy? So I've got one more. Amy, how does CIHR propose to support linking SPOR to policymakers in various jurisdictions?
So that I know that was one of the questions that was sent in advance, and I was delighted that was a question that you asked. I will say I was a little surprised too, because I know it's part of the funding requirements for support units that part of their work is actually to engage with policymakers. So I'd be really curious to engage in further conversation around what are the barriers that different support units are experiencing, and then seeing what, if anything, CIHR might do. I do think we do have some, because of our partnership work, we may have a role to play as a potential convener to kind of, or sort of catalyst. Maybe we can help to draw some more attention if that's the barrier, but I would love to dig into that a little bit more to understand what are the issues above and beyond that might be preventing you from gaining as much traction as you would like to see.
Good. Well, with that, we really thank you, Amy, for sharing your vision and details with us in patient-oriented research and taking time to answer questions from the audience.